Thank you. And I tried to get my 4-year-old son to come up with me, but I guess he didn't want to do it. One of the things that I'm so excited about PACE, it's not a competitive model of care. It's a collaborative model of care. And I want to tell you that the 3 years that we took, it might seem like a long time, but as a result of the 3 years, we have such an integrated and collaborative team of healthcare professionals, both in the private sector and in the public sector. And I think it's important when you look at even the signage and everything, this is a partnership with the Commonwealth of Virginia. And we're all embarking on a new mission. When you have a grand opening, it's normally a new building's been built, a new business is opening, but this is really a change in how we look at caring for our elders. And I've been in nursing home care for 34 years. And when I first got in it, I thought, well, we're doing great things. I mean, we're helping the elderly. What would they do if it wasn't, for nursing homes? But I think as you start to get older and you start watching your parents age and you start traveling around the world and you start traveling around the country, you see that there's different models. There's better models. And clearly, if you ask the elderly, they want to be cared for in the communities that they grew up in, they worked in, and that they lived in. They want to remain a part of that fabric. They want to go to the same churches. They want to be a part of the same, groups of people that socialize and get together. So what I'm so excited about is this program here. It literally will change the lives of thousands of people over the next 5 to 10 years. People that otherwise would have lived in fear that someday maybe I will require a nursing home. Or maybe my wife, who I've been married to for 50 years, will have to be in a nursing home. How will I get to see her? And the beauty of this program is we're all working together. Physicians, specialists, healthcare providers, and we're all trying to figure out how can we provide the best care to this individual, not just in the doctor's office, but in the home, in transportation, in how they communicate. So we're truly, truly excited about this. Everything Kissito does, we want it to be a model. We want it to be a best practice. We're fortunate there's only 90 PACE facilities in America, so our goal is to be the best out of 90. And as soon as this is the best, we really look forward to going to Salem, to Bedford, to Vinton, to Blacksburg, and being able to expand this program. Our goal is 800 people can avoid having to be institutionalized and be able to live at home in the Roanoke Valley. And that's going to employ about 500 new people that are going to be working in PACE. So we're very excited about the opportunity. We're very excited about our partners. I want to mention one partner in particular that has sort of worked through this with us day in, day out, thousands of emails. But, the Commonwealth Department of Medical Assistance Services, Terry Smith and all of her staff have just done everything they can to make this a successful program. So I really want to recognize and thank Terry Smith. Now, it's my great honor to introduce a dear friend of mine, my mentor, somebody that, like my board says, Tom, you got to slow down, you got to stop doing too much, but actually an advisor and mentor to our entire organization. Mr. Brand has had a remarkable life, and every time I'm honored to go with him somewhere, maybe to a reunion at VMI and hear the stories about pre-World War II VMI, learn about the Marshall Plan and his active involvement in that, learning about starting up TAP, and just hearing all the stories about getting on the phone, with President Johnson or Sergeant Shriver. And even one day I had a voicemail and I didn't get the message, and I listened, and Mr. Brand was saying, Tom, get over to my house right away. I've got President Carter's daughter here. I want you to meet her. and he's quick to get on the phone, too, to call the governor. And I just love his way of business operations. But Mr. Brand's programs, Kissito would be so happy if we could just accomplish a fraction of what he did, because most of the TAP programs, unbeknownst to everybody in Roanoke, have gone on to be statewide programs, and then they've gone on to be national programs. And the work we do internationally, I tell you, Mr. Brand is just as well known for his international work. I mean, things he did in the private sector, I mean, Bangladesh, China, Africa, I mean, just amazing, amazing things. And I know anytime I tell him about something, I told him the other day, I said, have you heard about purpose-built communities in Atlanta, you know, Cousins Properties? Tom Cousins was able to turn on, Tom Cousins, oh, he's a friend of mine at YPO, let's go visit him, you know, and he's just been everywhere, and it's just been our pleasure and honor to have him be a part of our organization and a part of my family's life. So I'd like to introduce Mr. Brand, who will say a few words for us.
It really is a pleasure for me to be here for a number of reasons. It's amazing that this concept this is the first one in the Valley, and it's the first one in our region, and we need to work together to make it successful. And in partnership with the state of Virginia. I remember when I was chairman of the State Board of Health many years ago, we visited nursing homes, and we tried very hard to figure out ways to keep people out of nursing homes and let them stay in the community. And this is an example of how we're going to do that. And I like to think of this as the whole facility, the whole idea is sort of an extension of your home. People can live in their home and still have the services that they need and stay with their family. So I think that the PACE program should have a subscript on the title, and that is, it's a home extension program. You stay in your home and you can do what you need to do, God willing, and with your whatever you're able to do physically. And I'm particularly excited and interested in this organization. And as most of you may know, I spent most of my life dealing with low-income people and trying to help people from Head Start on up to be independent and make a living and be self-supporting. And when you get to be 55 and older, like I am, you really can't do everything you wish you could do. But this program is exactly what I have tried to do for most of my life, is to try to make people independent and self-supporting. And as I say, this is an extension of your home. I'm particularly pleased to be associated with Kissito because they're not in this business to make money. They're a nonprofit organization. As a matter of fact, they're taking what income that they have and doing what they can as a global citizen. They are trying to create a better life for people in Africa, at least 4 countries in Africa: Uganda, Ethiopia, Sudan, and Somalia. And they are not in that to make money. They're in that to create a better world. And that's what we're doing here, is we're trying to create a better world. And I've gone with Tom to Academy of Science meetings, and as he said, with presidential meetings, to work on issues together, not for profit, but to make it a better world. We spent 3 days at the Institute of Peace in Washington because we wanted to see what we could do to promote peace in the world and not have wars. That's the ultimate goal. So I'm pleased to be a part and associated with this organization that's trying to make this a better world. And we're doing it one person at a time, and this program is the start for the Roanoke Valley. So thank you very much for being here.
I'm delighted to be here. I've been in PACE almost since the start. I love the program. I believe in the program. I think it's the wave of the future for all of us, including myself. Today is a milestone for Virginia in terms of providing both comprehensive and coordinated health and long-term care services for our seniors of Virginia through the opening of this PACE site, which will be capable of serving 120 individuals in the Roanoke Valley. This journey did begin in 2009 with an application in 2011, and Kissito submitted that to us, and we have worked very, very diligently with them. Thank you so much for your kind comments and working in collaboration to bring PACE to Roanoke and to Blacksburg. Unique about Kissito is it is our third PACE site of 14 that was not developed by a major healthcare system, and that makes it a little more challenging. We have 2 AAAs that are running, area agents on aging, that are running PACE sites. And Kissito comes from a background in nursing facility and international medical services, so it's been quite an innovative model from their side as well as from ours. Obviously, it serves individuals 55 years of age and older, and I usually tell people to look around. As it is now, I look in the mirror when I make that statement, and so I do think it's something that even I might benefit some at some point in time. We do have a fragmented healthcare system. I think we all understand that, both in financing and delivery. This system bridges that gap. PACE is the only, absolutely the only coordinated care system that we have for elders in the Commonwealth of Virginia at this point in time. And so we're hoping that it will grow even more. It assists our individuals we serve, their families, their caregivers, their healthcare providers, and our policymakers too, and that's critically important. We've seen tremendous growth. PACE in the Commonwealth of Virginia has doubled every year since it started up in 2006, and we're very proud of those efforts. Congratulations to Kissito on what a beautiful site that you have here. You can feel the warmth and the love, and I mean that honestly, in this building. We thank the Center for Medicaid and Medicare Services. They're our partners in working towards this. The staff here are the people that are really responsible for this. Steve is our program manager. We have Barbara McCrae. Barbara McCrae. We have Thelma, Colette, and Cynthia. These women are on the road 32 weeks out of the year, helping PACE sites around the Commonwealth to get up and to pass CMS inspections and to assure the health and safety of the people that live here. So they deserve a big round of applause themselves. Lastly, congratulations to Tom Clark and Sean Pressman for insight and true leadership in development of such a strong PACE program. Special thanks to Secretary Hazel and Governor McDonald for their continued support of PACE. We know that our loved ones and my father and mother, who are 82, are not far from this PACE site, so we'd like the next one to be in Rocky Mount, if possible. We know that they're in good hands. Thank you so much. It's a beautiful site, and we appreciate everything that you do for us and for the elders in the Commonwealth.
Good afternoon. You know, I'm here as I'm also a delegate, but I also have a mother who's 83 years old. We just celebrated her 83rd birthday, and unfortunately, or fortunately, we had to do so at a nursing home. And you know, we talk about, and we always, I'll be 60 my next birthday, and it's chic to say 60s, today's 60s, yesterday's 40s, but sometimes the body doesn't, and the mind doesn't always catch up with that chic saying. There's some mornings I feel 40, there's some mornings I feel 70. And I guess what I'm saying to you, for the last 3 years, I've had my mother with me at the house, because I believe that you know, parents should stay with their loved ones until you get to a point where you feel that you need some help. Now, I probably should have asked for more help sooner. But out of love, you know, you try to do everything you can, and all of a sudden one day it hits you. That it's not, it's humbling to need help. And the thing that I've learned through the process of the last 3 years is that sometimes love is just not enough. Out of love, you can actually harm your loved one. And, you know, nobody wants to give up anything. If any of you all have ever met my mother, she's still a fighter. She's like Cowboy Brand. She ain't going to give up. However, there were times where I knew she needed more than I could give her. because of my rigorous schedule. And, you know, most of us around here are young, some are younger than I, but if you figure that out, 20 years from now, I'll be 80 years old. Now, I hope I'll be able to stand before you all and look as good as I look now and feel as good as I look. But that's really not up to us. And my mother tells me all the time, she'll look at me and she'll say, you better hope you make it, son. Because simply because your parents live long doesn't mean you're going to live long. And simply because your parents live long and have this sound mind and their physical health doesn't mean you're going to have it. And so I think, you know, I look at the PACE program as sort of like a civil rights as far as I'm concerned. I think that anyone that works hard all their life, and I'm always proud to say that it's not how you start, it's how you end. And, you know, that American dream is that we work hard and take care of our families and raise our kids. And at the end, at some point, we want to sit back and enjoy what we've done. It's not promised that even though you do all those things, that it's going to come a time where you're going to be the same person you are today at the time when you want to sit back. And so it's touching to know that there is a program. I can honestly tell you that I believe, and it's not from any doubt, just experience that people do better in their own environment. They just do. I know I do better in my own environment. I mean, you know, we don't like change. And, you know, you go through a progression and you understand. I've learned so much over the last 3 years that, as I said, I look at the PACE program as sort of like it's our duty. We worked hard, we paid into the system. We ought to be able to enjoy it in an environment where we feel comfortable. And even the breast nursing home, and we have some great nursing homes, is never going to be better than the home that the environment where they can live and they can have their loved ones come in. And oftentimes, in my situation, my sisters and brothers live all over the country. So, and you know, your parents know which one they can push around. My mother decided to stay with me because she knew she could push me around. They know which child they can push around, trust me. But, you know, if you're not careful as a caregiver and you try to do it alone, you harm yourself. You really do. And you don't know it, and you think you're making a sacrifice out of love, and you are. But you're harming the person, and also there's those little nicks that get you. And so I finally came to the conclusion that you need help. And I would have much rather, and I hope we do a lot of these same Kissito programs through PACE, because I think the human thing to do is to allow a person to live in dignity in the environment where they're most comfortable. You know, I read a little bit about this. Other countries do it. We just sort of got it backwards because we're always rushing and we don't have time for this and everything's on the clock. But life is on the clock. It doesn't speed up. It doesn't slow down. It's just life. And the time you put into the elders, you know, will be at some point in the future when history is looked back on. They'll look back on our generation and say, how did you treat your children and how did you treat your seniors? And that's the measure of any society. It's not us people in between that's chasing the dollars and the BMWs and the nice 5-bedroom, although they're nice. But you get to a point where none of that matters. You can have all the money in the world. But if you don't have your faculties and if you don't have loving, caring people around you, it doesn't matter. I can tell you I got more house than I need right now. I stay in probably 500 square feet. So all of that work, I know as I get older, I'm not going to need that house. And it won't matter. And so what I would say to the PACE program and Secretary Hazel and all the fine people in State Office, Governor McDonald, you know, it's important that we not take this program as we do so many, start a program and just lord over it for the rest of the next 20 years and do no more. Because we talk about baby boomers, and I guess I'm one, or maybe I'm not. I know I feel old. I'm getting there. You just imagine how many people that would need these services. And we can't house them all in a nursing facility. Now, don't get me wrong, anyone. There's certainly times when a nursing facility is the proper place for a person. But it ought to be the last place, not where you start. It should be, if necessary, where you end. And as long as we can keep our mothers and fathers and loved ones at home, we ought to try to. And we should do so with more than just love. We should do so with consideration of, are we loving them so much we're neglecting them? And then you should never feel too proud to ask for help. And that's what this program is here for. I got in early, as they say. I didn't know what Kissito was. I couldn't figure it out. But as I started reading and talking to one of the representatives, I realized I was the type of person that I never would have thought that I would need services such as a program like this. I just wish it had happened sooner, but it's never too late, and I will promise you I'll lend any support that I may give, because it's, as I said, I see it as a human rights issue. You have the right to go on into your senior years with dignity and honor. Thank you.
Kissito PACE is all about breaking down barriers. The barriers that keep caregivers from continuing to do so. The barriers that make living independently in the community as we age so difficult. PACE addresses issues like safety and independence, isolation, transportation, access to medical care and medications, dependable home care, and maintaining proper nutrition. PACE provides also a safe and fun environment for our seniors, and a safety net for them and their families. Most importantly, PACE does all this without building any new walls to house and congregate our elders in nursing homes. Instead, we bring all those resources to them in the home. Kissito PACE is truly a breakthrough for this community.